Hello, I'm Dr. Bernard Camins. I'm the medical director for infection prevention for the Mount Sinai Health System. Now that masking is no longer required on all flights, it is important to remember that masking does protect you. Uh, it really depends on what face mask you need to wear, but a well-fitting mask is actually better than cloth masks. So if you needed more protection because you're immunosuppressed or that you have relatives or loved ones who may have increased risk for complications from getting COVID infection, you may want to protect yourself from getting infected. The best way to do this is by double masking. That's the easiest way, which is really just to put on a medical or surgical mask on your face and then wearing a cloth mask on top so then the mask fits your face better. Other better protective masks are KN95s or even N95s. The reason they work better is because it does it fits snugly against your face. Other things that you could do is potentially sit by the window, because then that keeps you away from everyone walking down the aisle, and it does keep you away from most interaction with other people. That is reducing your risk for exposure. Other things that you could do are to then board later as much as possible, or and then try to leave the plane as soon as possible. The reason is the HEPA filters do not are not functional um, while the plane is on the tarmac or during takeoff and during boarding and of course deplaning. While you're up in the air is filtered by HEPA filters, and they are very effective at certainly eliminating respiratory droplets. As a matter of fact, I am leaving on a trip to Europe next week. And so, in order to prepare myself, and being over 50, I've actually taken a second shot of the COVID 19 vaccine, or the second booster, that is. I am over 50, and so I did qualify for it. And so it, it is an anticipation that I may be exposed to COVID while traveling, and so I just wanted that extra protection. If you are over 65 and certainly immunocompromised, you should definitely get the extra boosters once you're eligible for against COVID 19. That just increases your chances of being able to avoid getting severe disease uh, or being hospitalized from getting from a COVID 19 infection. Other things that I've done is that I do plan on wearing a more protective mask, like an N95, and at least keeping it on, uh, even though they're no longer mandatory while I'm on the plane. Yes, as I've mentioned earlier before, wearing a better or well-fitted mask is actually advisable for in order to protect you, right? In healthcare, our healthcare workers, when they are taking care of patients, most of the times, even COVID patients with COVID are not wearing masks, and so they actually put on N95 respirators or N95 masks then to protect themselves. So if you are able to get an N95 or a KN95 mask that fits your face well, that will then be more protective for you. Again, if you can't have access to those masks, then putting on a medical or surgical mask with a cloth mask on top would actually has studies have shown that that's almost as good as wearing a KN95 mask. If you develop symptoms of COVID, I think that it's probably, if you have easy access to a PCR test, that is probably, you should go ahead and do that as opposed to doing an antigen test. The rapid antigen tests are actually very helpful only because they're much more available to the public. So one of the ways you could use the antigen test is after your trip, after you fly on a plane, you test yourself 2 to 4 days after, or if you develop symptoms and you can't access a PCR test. Just keep in mind that you actually should evaluate your own risks when you travel. For example, eating outdoors may actually be safer than eating indoors, especially if you are immunocompromised or you're at high risk for complications. If you have unvaccinated children around you. Um, Wearing a mask still can protect you if others are not wearing their mask. And I think it's also good for everybody to check themselves for symptoms of COVID daily and get tested so then you can isolate appropriately if you test positive. And finally, you should really be up to date on your vaccination, meaning if you're unvaccinated, please go get vaccinated. If you are fully vaccinated and eligible for the first booster, you should go ahead and get your booster, as it does protect you from getting infected with the Omicron variant. And then lastly, if you are over 50 and potentially at risk for complications because of other illnesses, such as immunosuppression, then you should really consider getting the second booster if you're eligible.